When was the last time you had a difficult interaction with an angry or upset patient? You felt ambushed, didn't know what to do or say, it did not go well, and you felt bad for days. This is Dr. Dike Drummond at thehappymd.com, and in this short video I'm going to show you a way to deal with angry and upset patients quickly, efficiently, effectively, empathetically, and get on with your office day and home on time. I call it the Universal Upset Person Protocol. See, most of us don't get any training on how to deal with emotionally upset or angry patients, so we do what comes naturally. We either try to fix their problem, or we try to defend ourselves or whatever the upset person is upset about. And that's just about as effective as throwing gas on a fire. Here's why. See, in an ordinary office visit where the patient's not upset, you can talk about what brought them in. But if they're upset, if there's a lot of emotion in the room, it's feelings first. They simply have to share their feelings and feel understood and listened to before they can go any farther. Teddy Roosevelt once said, "People don't care how much you know until they know how much you care." It's exactly like that. And the Universal Upset Person Protocol is the quickest way to give the patient a safe place to vent their feelings, share them with you, you to listen so you can wrap it up and move into the clinical part of your office visit. Let me take you through the 6 steps of the protocol real quickly here in an overview, and then we'll go into them in more depth in just a minute. And just so you know, down below the video frame here is a handout that gives you a full training, including all the statements and questions in the protocol. Make sure you get that before you're done here today. Here are the 6 steps. Number 1, you look really upset. Number 2, tell me about it. Number 3, I'm so sorry that this is happening to you. Number 4, what would you like me to do to help you? Number 5, here's what I'd like us to do next. Number 6, thank you so much for sharing your feelings with me. It's really important that we understand each other completely. Thank you. Now let's drop down and go through those one at a time. Upset patients come in 2 flavors usually. One, they're obvious and they're verbal. You can hear them coming down the hallway. Second type are quiet and seething. They don't speak, but everybody knows they're upset. Either way, if you notice this, you're not going anywhere till they clear these emotions. So your first statement is, "You look really upset." You'll typically get one of 2 responses. "You bet I am" is one, and the second one is, "I'm not upset, I'm frustrated." Or they may name some other emotion like that. Now there's a piece inside of you that may feel bad. You may feel like you got it wrong. You can let that go. Your observation has caused them to look inside and get clear on what they're really feeling. That's the first thing they have to do, so great job. Here's step number 2. Tell me about it. What you've done here is given them a green light to tell you their experience, and your job is to listen, to understand what they're going through, and make sure they notice that you're listening, they feel heard. And here's step number 3. No matter what's happened, you can apologize. "I'm so sorry that you're feeling this way. I'm so sorry this is happening to you." Let them know that you have sympathy for their situation. Critically important to maintaining your bond with this patient. Here's the next step. What would you like me to do to help you? And here again, you've got to listen. And as you're listening this time, notice your boundaries. Notice things that the patient may request that you're not comfortable with. Next step, when they're done, take a pause, think about what you're willing to do, and tell them, "Here's what I'm willing to do going forward. Here's what I suggest. Here's a plan I recommend." And any time that you are not giving them something they've requested, tell them what you are going to do instead. And last, to wrap this difficult encounter up in a way that builds your relationship for the long term, thank them for being willing to share their feelings with you. Let them know how important it is that you each understand each other clearly. Well, there you go, 6 steps to the Universal Upset Person Protocol. And this works with anybody who's upset. Your children, your significant other, your colleagues, your staff, random people on the street will respond to you much more positively and go breezing right through their upset when you use the protocol. I know there's 6 steps. However, normally in the office with a normal patient, it'll only take you 2 or 4 minutes to do this. And if you don't, if you instead try to fix their problem or defend yourself, you are going to be in for a 20-minute kerfuffle, and you know the kind of patient interaction I'm talking about. Once again, the handout for this training is right below the video frame. Click it and make sure you get your copy. And this is Dike Drummond from thehappymd.com. When you're looking to lower your stress, prevent burnout, become a more powerful leader, come visit thehappymd.com and get the tools so you can be a happy MD. That's it for today. Keep breathing, and you have a great rest of your day.